So I wish I'd have gotten that shot of you getting in that chair.
Oh, we're on. Okay. Yeah, man, leg day's rough.
How many days we're into it? 2 days?
2 days. This is day 3.
Can you take your kid up and down stairs yet?
She's big. No, I can't. She's a big one.
Yeah.
I can barely get myself up the stairs.
Well, at least you're hitting it.
I'm hitting something.
What workouts are you doing? What is it?
I don't want to tell you because you're going to laugh at me.
Is it beach body?
Maybe.
Body by body?
I mean, it might be beach body.
Or are you doing, what is it, Taibo with Billy Blanks?
I'm doing some straight up CrossFit stuff.
Okay, there it is.
I'm not, that's a lie.
You're not going to be using the bathroom for a few more weeks.
Oh, gosh. No public restrooms.
So, let's talk about some cool things that we've experienced this week.
Okay.
And last week. One of the things that we had a kid come in. You asked me last time about pediatrics and, what's my favorite case, this and that. And one of my cases about pediatrics. And I figured this is something that was extremely important for you guys to hear because you don't get to see or hear this all the time, or probably even rarely. But we had a kid contact, or it was the parents that contacted us, and they have a kid that is about 5 or 6 years old. And she is one of 4 patients in the United States that has a chromosomal disease that makes everything in her guts just kind of tighten up and sphincter up, and there's a lot more to it. But part of the problem, what they're needing help with, is that she can't have a bowel movement without having to bear down so hard and have hemorrhoids. And I forgot how many bouts of hemorrhoid cases that she's already had. And they've tried everything. They've been to everybody, done this, done that. And now they're like, oh my God, this is our last resort. We don't even know what to do after this point. So, we come in and we do a little nerve scan up and down the back to see how is the nerves behaving, and it pinpoint different areas of different parts of the spine. I said, hey, this is where you're finding some areas where the nerve is overactive. And if we get that calmed down by getting normal spinal motion in there, we should see some things to behave better. And so visit 1, mom came in and we went over all that. We did an adjustment. Nothing miraculous happened. But she came in the next day, and dad brought their daughter the next time. And what we ended up seeing was that there was a little bit better sleep. Just a little bit better sleep. That's all they noticed. The next time they came in, mom came in with her kiddo, and she said to me that her kid was on the toilet, and she goes, "Mom, I'm not even having to push to get everything to come out."
Oh my gosh, I'm glad I wasn't here. I would have been crying.
Yep. Just in 2 or 3 visits, it's like you're getting something that's just so unbearable for this child that's producing hemorrhoids at such a young age, and it's just like, holy cow, you get stuff like that.
Wow.
That's what gives me goosebumps when you hear life-changing things like that. So, really cool. We're tearing up a little bit.
Glad we started on that note. Sorry, I'm still postpartum.
Yep.
That's why I've got my postpartum here. Don't hate. And
I'm postpartum too.
Yeah, postpartum hormones are still going.
I stayed up all night with my kiddo last night. So she's getting better though. Which is another cool story too. We had a baby girl almost 6 months ago. And so when she was newborn, it was just one of the healthiest babies and healthiest deliveries that you could have had. And so Lexi, was having some problems with her blood sugar though, to where it was just bouncing around. It wasn't low. It was just on the lower end of normal, and then a couple of times it bounced low. And so this is our first child, first experience of, for us being in the hospital as parents. And, we ended up, having an issue where, all day had been great, and then Chastity needed a fan, so I went home to go get a fan, showered up.
Chastity is his super hot wife.
Oh, yeah. Ain't no other way, baby.
Smoking.
Love you, boo.
Me too.
Yeah. And so, when in this time frame, it was only about an hour lapse of time that I left and came back, and I was almost back to the hospital, and I get a call from Chastity in tears and kind of hysterical moment. And, I was like, what's going on? And they go, well, the whole team, nurses, and everybody's up here, and they're saying they're having to take her to the NICU. And I'm like, how in the world are you, I'm gone an hour, and there's no mention of anything going wrong or anything. It's like, now all of a sudden, it's like, we got to take her to the NICU.
The doctor's gone. Let's get her in.
Yeah. And I'm just like, well, I'm literally pulling up, and we get back upstairs. finally, and there's the whole team in there. And they're like, oh yeah, because of her blood sugar irregularities, we're having to take her to the NICU. And I'm like, wait, what's going on here? And that was just their standard protocol. And I was like, holy cow, this is standard protocol? And so how come we're just now getting word of this, that this is going to be a thing? And so we're freaking out. And we're trying to figure out what to do in order to handle all this. I got my wife who's just given a child, incredibly upset, and I got a baby who has been as healthy as she could possibly be. Now all of a sudden, then she's going to the NICU.
It's a big turn of events.
This is during all this COVID stuff where nobody's there to help out, and so I'm sitting there stuck. I'm like, well, what do? Do you stay down here with your kid? Do you go back up there with your wife? What do you do? And so it was this whole stressful event. And honestly, it was probably something that, I know that they have their protocols and everything else, but looking back on things, it probably wasn't something that needed to happen, had we given it a little bit more time. And this has come from some advice from our her OBGYN that did the delivery. It said, used to be they just give her some sugar water and, give it a few more hours and everything else. But we were going through this whole stressful event, and so I had to compartmentalize all my emotions. And finally, once we got down into the NICU and, compartmentalized, everything was still battling where her blood sugar is just all over the place. Well, these are the cases that comes to see me when they've had enough of everything else that's not working.
Yeah.
So I had to put all of this aside and start thinking clinically. And so we did some different adjustments that are very light adjustments, almost kind of like if you're lightly pressing on a piece of fruit or vegetable to see if it's, something you can go home and cook tonight. And so that's what we did with Lexi. And after even just one adjustment, they came back and finally took some more blood work. And it was the first time that, her blood sugars were spiking high and staying high into normal levels and not sitting there just kind of teeter-tottering on the lower end of normal. And so now it's like, okay, at that point in time, she skyrocketed to where everything was just balance out. And that was just from one adjustment in the NICU. And so those are things that we had to deal with in our own personal life with Lexi. And now we see that, she's about as happy and healthy as she should be. Immune system's working and building. She's sick right now, and she'll get over that here in a couple more days and, keep building more immunity.
I just feel really bad for that 5-year-old. 5 years of just being a parent and knowing how helpless you feel whenever your babies are sick and you don't know what else to do. There's so many things that you've told me that you can help with pediatrics, and I had no idea, and it makes me so frustrated that advice was never given to me before.
And it's all too common. We see so many cases of where pediatric cases, it's just, you don't know what you don't know, and pediatricians aren't taught what we're taught. But we see it so many times that there's just cases that just fail, in the traditional world of medicine. It's all because you miss the most basic steps of normal nerve function through normal spinal function. So
I'm so glad they found you.
Yeah. Well, I'm here to help, and so if you have any type of pediatric, type of questions, whether, some of the top cases that I guess you'll Google and find are, to ear infections, constipation, colic. Many times you can get kids like with different types of pain-related things, usually headaches also.
And growing pains.
Yep. As the kids grow, it puts challenges onto the nervous system, and that's why they can have pain in different areas too. So, but outside of that, make sure you bring me any questions you got for pediatric cases.
Absolutely.
Yeah. So we want to talk about some of the insurance stuff. We get insurance questions all the time too. It's like, hey,
topic.
What would be one of the things that you think that we hear about most?
Do you guys take my insurance?
And most of the time, yes, there are different ways of taking that insurance. And we are credentialed with who?
Blue Cross and Blue Shield.
Correct. But we're not credentialed with, say, like United Healthcare. But there are what we call in-network and out-of-network benefits. So, that's part of the reason why if you call up any clinic, not just my clinic or any other chiropractic clinic, but any other medical clinic, and you ask if do you accept my insurance? Well, yes, if they want to file the out-of-network benefits.
Right.
So you need to know what your out-of-network benefits are. And there's a whole different, I don't get how this insurance can get away with this, but they have their whole in-network deductible, which is sometimes meetable, and then they have their out-of-network deductible. What's the out-of-network deductible usually?
Oh my gosh. It's so wrong.
Through the roof. Through the
So
roof.
wrong.
And so,
And hopefully you'll never meet that. Hopefully you
Yeah.
won't have to have that much medical requirements to meet that deductible.
and because of that, that's why we have, time of service discounts to where if you have such a high deductible and we want to avoid going through insurance and keep things more cost effective, we do have some better cash plans.
The care plans are very beneficial.
Yep, it does helps people understand what they need and what, getting the repetition in that they need, and they're getting the help that they need, and they actually need less from us, even in a short period of time, but even more so in a long period of time too. So
You coming up with that was brilliant.
well, I've learned that from other successful practices where they've been able to help a ton of people.
Yeah.
They usually, people are seeing 600 visits or more a week, and they're helping a ton of people. And part of that is because they made it so easy for the patient to have what's expected of them, and making it easy on their payments there too. So that's part of the reason why we started implementing things like that too.
Let's talk about the veterans.
Yeah, so one of the things is that we have some different type of insurances that are out there, and I think it's Railroad is the name of the insurance, but it doesn't really give us a whole lot of coverage, and it hasn't been really effective for vets getting the type of health care that they need through chiropractic care. And so they came up with a veteran program that you can actually go in and get a prescription through the VA clinic to come see a chiropractor of your choice that's enrolled with this program.
That's so awesome.
Yep, and we're newly enrolled with them, and so typically now, like once you get that from the VA clinic, they should be covering the cost of your visit up to a certain amount, and I think that would cover the adjustments alone in chiropractic clinics. So if you're a vet, definitely worth your while. I know the VA clinic will probably use up a lot of your time to get that prescription, but it's worth your while to get some things in action so you can start getting the health care that you need without having as much of the responsibility financially.
Absolutely. So many
deserve
veterans suffer silently, and now there's this. You can do something about it.
Yep. So there's so many failed cases through physical therapy and pain management, and once they start seeing that we do what we do in chiropractic, they're like, oh my God, this is just a world of difference better. I mean, just think about our patient that came in, without sharing his name right now for HIPAA violations, but we had a VA guy come in and got adjusted. He'd been to other chiropractic clinics, and we had him laughing hysterically because of he was just unexpectedly the results of what he got from our clinic versus some previous results he'd gotten from another clinic.
He was expecting to get popped, and you actually adjusted
Yeah.
him.
So I mean, we do what we do in here, and we took care of him, and he was just overly ecstatic, happy
That was
about his
hilarious.
results. So, if you're a vet, I would suggest looking into what contacts you have for if you go to the VA clinic or VA hospital, and seeing about trying to get you a prescription too to see chiropractic care for any type of pain related thing. If it's a neck thing, back thing, shoulder thing, hip thing, they'll do probably a quick evaluation and write you a prescription to go see some chiropractic care for over a period of time.
Come to us.
Yeah, we'll be glad to help you. Outside of that, we talked about pediatric stuff today. We talked about insurance stuff. We talked about VA program. Anything that you guys have questions to regarding any of those, you can definitely email us at info@bhamhealth.com. You can check out resources that we have on our website at bhamhealth.com.
And if you have any questions about anything else that we haven't been talking about, just hit us with whatever you got.
Yep. Call us at the clinic. You can reach us at 205-385-9999. Awesome. Anything else we got to go over this week?
I think that's it for right now.
More CrossFit, right?
Beach buddy.
Have a great week, guys, and we look forward to speaking to you next week.